Hi, welcome to Fast Intelligent Care. This is our part 4 with Belinda Dwyer. She's a OT uni lecturer at Flinders Uni. In our previous episodes, we talked about her previous work experience, her current role as a lecturer. We've talked a bit about student experiences, the experience during placement, what pressure care education looks like, as well as some of the experiences of new grads, so once they've actually gone out practicing. In our last episode, we'll have a very short one, but it will be some advice for students, advice for those early career clinicians, and just wrapping up in general what we've talked about in terms of pressure care and pressure care education. So first thing I'll ask is if you were to speak directly to some of your OT students, or even any students listening right now, what would you want them to focus on when they're learning about pressure care? There's a few things that you want them to just remember.
So obviously understand anatomy, bony prominences, where the risks of pressure are, but also what causes pressure in terms of force versus area, because obviously that then will direct their reasoning relative to when they are choosing support services. Surfaces, not services. Also, as OTs, focus on function. So, while if we look at our OT hierarchy, AT comes down lower, how is that client actually engaging in those occupations? What's meaningful for them? Focus on that. Look broadly. So don't just focus on the support surfaces. I'll get it out. That we want to look at how that client's moving, what's important to them, but also what role the carer is playing in assisting them to move, what sort of tools are being used to reposition, but also from the perspective of being a new to the area, new graduate, ask questions. Yes. You're not expected to know everything. This is a learning journey. As a new graduate, in most organisations there is a supervisory structure, and it's there for a reason. It's to support learning experience. So certainly reach out, look for supervision, look for mentoring, look for PD opportunities in that area that you're working for, so that then it will build your confidence to then be able to apply that clinical reasoning, that clear documented clinical reasoning that we need when we are particularly asking for funds from the various funding bodies.
That's really good advice, thank you. And what advice would you give in terms of building confidence? I know you said ask questions, but is there other ways that you would advise OTs to build confidence in this first year of work?
I don't think you can understate reflective practice. So looking at the outcomes of that intervention, reflecting on, did I achieve what I wanted to achieve? Are there some gaps that I then need to work on? Because that way then, if they're identifying some of the things that they're not feeling as strong on, it gives them a plan to then work on that, seek that support, which then ultimately then builds the confidence to then work in the area and feel like they're not an imposter.
Yeah, and I think a lot of us do experience that imposter syndrome, especially
ongoing.
Yeah, it is ongoing.
Yeah.
But something actually I want to go back to a bit is when you mentioned about us focusing on function when we're looking at pressure care as well, and something that I've actually attended was a meeting or a CPD on it recently about how what we do with bedbound clients, the clients that need to stay in bed, in terms of thinking of pressure care. And one of the stories that came up was about Frida Kahlo. I don't know if you've heard of her, where she actually started painting when she was in bed, where they actually had this, her dad had this big easel constructed above her so that she could be bedbound but still engage in activity. And there was a lot of talk about how do we, a lot of clients, if you're staying in bed for that long, if you're, a lot of times it's because you're you are on bed rest, you have to,
Yeah.
but you can still engage in something that's meaningful, something that's purposeful.
Yeah.
Otherwise, a lot of clients will not want to actually follow those instructions, even if it's good for their health.
Yeah. Yeah, because it's not meaningful for them to lie in bed looking at the ceiling or watching television.
Yeah.
So,
and I think we do forget about that a lot.
Yeah.
Is that function part, focusing very much on like, are you relying on a good support surface?
Yeah.
Looking at the manual handling, but we're not always considering that aspect. So I'm glad
but
you
even
mentioned
even the properties of that support surface, isn't it, to enable that engagement. So, you know, can they sit up, but at what point are we then introducing shear? So how can we counteract that yet still enable them, a la Frida Kahlo, to then be painting amazing paintings?
Yeah. And I know you mentioned in our first part, episode about the PEO model, and that really works well with that as well. It's not just looking at person environment, you're looking at the occupation as well.
Yeah. Yeah.
So love it. I love using that tool. I'm glad to hear that it's still very relevant.
I mean, there are other models as well, but the PEO tends to resonate with me more than others. So,
is there any other models in terms of pressure care that you would incorporate? Or was PEO a good one?
Well, I mean, I'm obviously coming from a bias because that resonates with me. But certainly there are other models, the Kawa, Mohos, that we can certainly still apply to the pressure care model.
Yeah, and it's probably a little bit off topic because we talked about it in our first part. But you mentioned the students do still use the Waterloo and the Braden.
They're exposed to those.
Are they exposed to them?
Because they are what are still commonly used in particularly acute hospitals. So in terms of giving them the confidence when they're moving into agencies for placement and then ultimately in graduation, we need to be across the tools that are being used by clinicians currently and be able to support our students in that, so that then they do feel confident in, or it doesn't feel completely alien when they're walking into a placement or a workplace.
Yes.
And feeling like they're on the back foot.
Yeah. And do you feel like there's enough confidence in OTs to know that not to just rely on the tool, it's just one tool, but to also incorporate
I
interviewing?
I think the educators in Australia are very clear on it. Any of these tools, outcome measures, standardised assessments are to be used to augment clinical reasoning, not replace it.
Yes.
So it is about looking at clinical reasoning from a holistic point of view and not just relying on a tool or a score. It can help clarify, but really nothing replaces looking at that person, understanding where there are breakdowns in their occupational performance and how then the OT can intervene to help overcome that and improve that quality of life.
And I think when we talked a little bit about confidence in terms of once we are practicing, I think something that I've heard a little bit across from when I've talked to peers or other OTs is we have all the stuff that we need to learn, and that sometimes when we're out of uni we get this imposter syndrome where we feel like we actually don't know that much. But I think something that I found about studying OT and what I've heard from my peers as well is it teaches you how to think.
Yes.
It teaches you
that critical thinking.
It teaches you the critical thinking, and I think that's something that we sometimes we don't realize that we actually have that. And then once it clicks that it's something unique that it comes after this period of time that you've studied, it becomes automatic, so you kind of don't realize that you have it. And I think I've had a physio actually have to tell me, like, no, not everyone thinks like this. Uni has taught you to think like this, and it gives you that little bit of confidence that actually, no, I do know what I'm doing. I can reason through this. I can have that critical thinking.
Yeah, and I think that's spot on. And I know that we talked about what I see in the difference in students when they come back from their first placement, and it's that clinical reasoning, that critical thinking. We get them as these little hatchlings, and they're spreading their wings, and it's lovely to see.
Yeah, that's wonderful. Great, thank you, Belinda, for your time.
Thank you for having me, Chanelle.
Thank you, and for your wonderful input and perspective. I love hearing about what the students have experienced as well. And we'll end it off there. This was our part 4 of our series with Belinda Dwyer. And we'll see you guys next time, next Tuesday. Please leave us a comment. We'd love to hear, especially if you're a new grad or you want to share about your experience in uni, something that you've learned as a student, how you've experienced going from being a student to going into placement, being a new grad, some tools or anything that you've used. We'd love to hear from you. Thank you. Bye.